Hello everyone, myself Vinoli, working as a tutor in Jubilant College of Nursing. In this video, we will be discussing about monitoring of central venous pressure. Let's get on to the video. Overview of the topic is introduction, types of central line, indications and contraindications of central line, peripheral inserted central catheter, line indications and contraindication, and central venous line insertion, factors affecting central venous pressure and central venous pressure monitoring, and interpretations of waveform of central venous pressure. Let's see what is central venous pressure monitoring. Central venous pressure is the blood pressure in the vena cava and near the right atrium of the heart. So the central venous pressure that reflects the amount of the blood returning to the heart and the ability of the heart to pump the blood back into the atrial system. So the normal range of the CVP, the central venous pressure, is 5 to 10 mm H2O. Mechanical ventilation, the central venous pressure is 3 to 5 cm H2O higher. Now let's see central line lumen types. There are three types over there. One is single lumen types, double lumen and triple lumen. Now let's see what are the indications for inserting a central venous catheter. One is volume resuscitation, emergency venous access, nutritional support, ino drops, hemodialysis, central venous pressure monitoring. Volume resuscitation. In order to rapidly deliver large amount of fluid or blood. For example, a person short central venous catheter is indicated. Emergency venous access is, for example, withdrawal or for medication administration. Third one is the nutritional support. In order to deliver nutrition directly into the blood. When foods or liquids cannot be given through the mouth or stomach or intestine. For example, total parenteral administration. Next one is ino drops. Critically ill patients need supports of ino drops which cannot be given through peripheral line, and hence such cases central venous catheter is indicated. Hemodialysis. To connect a person with renal failure to a hemodialysis machine that clears a body of waste and extra fluids. And other indication is central venous pressure monitoring. Now we will see common size for inserting central venous catheter. The first choice is internal jugular vein, right and left side, and the second choice is subclavian vein, right and left side, and axillary vein for right and left for we can inserting the central venous catheter, and groin for femoral veins we can choose, or PICC, peripheral inserting central catheter. What are the factors affecting the central venous pressure? One is cardiac function and blood volume, capacitations of the vessels, and intrathoracic pressure and intraperitoneal pressure. And move on to the causes for increasing the central venous pressure. One is over dehydration and right side heart failure, cardiac tamponade, and constrictive pericarditis, and pulmonary hypertension, and tricuspid stenosis and regurgitations, and stroke volume is high. Next we will see what are the decreasing causes for the central venous pressure. One is hypovolemia and decreased venous return, and excessive veno or vasodilation, and shock. If the measure is less than the 5 cm, what are that? Mean that the circulating volume is decreased. Now coming to the central venous pressure monitoring. Now we will see what are the methods to measuring the central venous pressure. We have the two assessment, one is an indirect assessment and direct assessment. Indirect assessment is we can see the inspection of jugular venous pulsation in the neck. Whereas the direct assessment, fluid filled manometer connected to the central venous catheter, which is a calibrated transducer. How to measuring the central venous pressure using a manometer. So the first, line up the manometer and with the phlebostatic axis, ensuring the bubble is between two lines of the spirit level. So first of all, we should know about what is phlebostatic axis. It is mean fourth interscosal space mid axillary line level of the atrium. So see this figure. Here the phlebotic axis marked on the patient chest is the precise anatomical point of the origin of the hemodynamic pressure being measured. Now move the manometer scale up and down to allow the bubble to be aligned with the zero on the scale. So this is referred to as zeroing the manometer. Next, turn the three-way tap off to the patient and open to the manometer. Next, open the IV fluid bag and slowly fill the manometer a level of higher than the expected central venous pressure. After that, turn off the flow from the fluid bag and open the three-way tap from the manometer to the patient. And next we can see the fluid level inside the manometer should fall until the gravity equals the pressure in the central veins. When the fluid stops falling, the central venous measurement can be read. If the fluid moves with the patient breathing, and read the measurement from the lower number. So finally, turn the tap off to the manometer veins. Finally, document the measurements and report any changes or abnormalities from the patient. We will coming to the measuring the central venous pressure using the transducer. Turn the tap of the patient and open the air by removing the cap from the three-way port, opening the system to the atmosphere. And after that, press the 0 button on the monitor and wait while calibrations of occurs. Then when the zeroid is displayed on the monitor, replacing the cap on the three-way tap and turn the tap on to the patient. After the zeroing, observe the central venous pressure trace on the monitor. The waveform undulator as the right atrium contracts and relaxes and emptying and filling with the blood. Look at the picture. Here the light blue in this image is showing the central venous pressure waveforms. Next we'll move on to the interpretations from waveforms. The central venous pressure waveforms consist of 5 basis events and 3 peaks, that is A, C, V, and 2 descendings or X and Y. What are the A, C, V peaks? A means atrial contraction and C is a closure of tricuspid valve and V is venous retent. And what is the descending X and Y? The X is atrial relaxation and Y is ventricular Y wing. What is A wave? It is a atrial contractions after the P wave. The prominent A wave means it is resistance in the right ventricular filling and right ventricular hypertension and tamponade and pulmonary hypertension. The A waves occurs as the right atrial contractions against the closes. The junctional rhythm and ventricular arrhythmias, the A waves can be occurs. And absent of A waves is the atrial fibrillations or flutter. Coming to the C waves, it means isovolemic right ventricular contractions and right atrium. It is after the QRS. It is the early systole or TR is tall systolic and C2 V waves and it is called polysystolic cannon V waves. Coming to the X descent, it means atrial relaxation, which is mild systole or dominant X descent. It is a good right ventricular functions and vice versa. The cardiac tamponade in the X descent is steep and Y descent is diminished. And next move on to the V waves. It is a filling of right atrium with venous blood just after the T waves. It means the late systole and the prominent V waves with increasing the venous return. And the large V waves may also appear later in systole if the ventricular becomes non-compliant because of ischemia or right ventricular failure. It is decreasing in right atrium emptying. Coming to the wide descent, which means the early ventricular filling, and it is early distole, and attenuations of the wide descent is tachycardia and right ventricular filling and tamponade. Next, move on to the central venous pressure changes with respiration. A wavis is during the spontaneous ventilations and the onset of inspiration, which causes a reduction in intrathoracic pressure and which is transmitted to both the central venous pressure and pulmonary artery pressure waveforms. The central venous pressure should be recorded at the end of the expiration. Whereas the B waves is during the positive pressure ventilation and the onset of inspiration, the causes which is the increasing the intrathoracic pressure. Central venous pressure is still recorded at the end of the expiration. Coming to the nurse's role, monitor for the signs of complications, assess for patency of CVP line, and sterile dressing should be done to prevent infections. Central venous pressure care per the hospital protocol. Length of the indwelling catheter should be recorded and regularly monitored. Thanks for watching. Subscribe our channel.